activities a nightmare. But today I'm going to show you a natural solution that targets the root of the problem, not just the symptoms. And the best part, it's something simple you can eat every morning. Stay with me, because this small change can make a massive difference in your pain levels and mobility. Sciatica pain often gets misunderstood as just a simple back problem, but the truth is far more complex. The sciatic nerve, the largest nerve in the body, runs from your lower back down through your hips, buttocks, and legs, controlling both sensation and movement in these areas. When this nerve becomes compressed, irritated, or inflamed, it can cause sharp shooting pain, numbness, tingling, or weakness that travels down the leg. Many people try to mask these symptoms with painkillers, stretching, or temporary treatments, but these approaches only address the surface level, leaving the underlying cause untreated. The key to reducing sciatic pain lies in understanding the intricate connection between your spine, your muscles, and the nervous system, and then targeting the factors that actually provoke nerve irritation. Inflammation is a major player in sciatica, often triggered by dietary choices, poor posture, or a sedentary lifestyle. When the tissues around the lower spine become inflamed, they put pressure on the sciatic nerve, creating that classic shooting pain that can interrupt sleep, work, and even simple daily activities like walking or bending. Many patients are surprised to learn that inflammation in the body doesn't just come from injuries. It can stem from nutrient deficiencies, chronic stress, or hormonal imbalances. For instance, magnesium deficiency, which is surprisingly common, contributes to muscle tightness and nerve sensitivity, making the sciatic nerve more prone to compression. Similarly, low vitamin D levels can weaken bone structure and spinal support, creating a perfect storm for nerve irritation. Addressing sciatica means addressing these root causes rather than relying solely on surface-level remedies. Another factor that is often overlooked is the role of the core and surrounding muscles in supporting the spine. Weak abdominal and gluteal muscles fail to properly stabilize the pelvis, which shifts stress to the lower back and can compress the sciatic nerve over time. Tight hamstrings, hip flexors, and piriformis muscles also aggravate the nerve by increasing pressure on it during normal movement. Even small daily habits like sitting for long periods without breaks or poor ergonomic setups exacerbate these tensions. People frequently underestimate how much lifestyle habits affect their nerve health, yet a proper understanding of anatomy and biomechanics is crucial to relieving pain naturally and sustainably. Nutrition plays a surprisingly critical role in this process. Certain nutrients, particularly magnesium, antioxidants, and healthy fats, directly impact nerve health and inflammation. Magnesium relaxes tense muscles, reduces spasms around the spine, and improves nerve signaling. Omega-3 fatty acids calm systemic inflammation, which can reduce pressure on the sciatic nerve. A diet lacking in these essential nutrients allows inflammation to persist, prolonging pain and slowing recovery. By focusing on anti-inflammatory foods and key nutrients, you create an environment where the sciatic nerve can function optimally without chronic irritation. Many people don't realize how connected sciatica is to overall health. It's not just about the back. It's about your nervous system, muscles, spine, and even metabolic health. By approaching sciatica as a systemic issue rather than just a localized pain problem, you can make meaningful progress. Small, consistent actions, like improving posture, strengthening the core, addressing deficiencies, and reducing inflammation through diet, compound over time and create lasting relief. Understanding these root mechanisms allows you to take control of your nerve health and ultimately reduce the pain that has been controlling your life. Almonds are not just a common snack, they are a nutritional powerhouse that can significantly influence inflammation and nerve function in the body, which is particularly relevant for people struggling with sciatica pain. Most individuals overlook the connection between specific nutrients and nerve health, yet consuming the right foods consistently can make a dramatic difference. Almonds are exceptionally rich in magnesium, a mineral that many people are deficient in. And magnesium plays a vital role in muscle relaxation, nerve signaling, and maintaining proper spinal alignment. Without adequate magnesium, muscles surrounding the lower back and hips can remain tense, increasing pressure on the sciatic nerve and aggravating pain. By incorporating almonds into a daily routine, you provide the body with a steady source of this essential mineral, supporting the muscles and nerves that directly impact sciatic function. Beyond magnesium, almonds are loaded with antioxidants, healthy fats, and vitamin E, all of which contribute to reducing systemic inflammation. Inflammation is one of the primary triggers of nerve irritation, and chronic low-grade inflammation often goes unnoticed until pain becomes severe. The monounsaturated fats in almonds help calm inflammatory pathways, which can reduce swelling and pressure around the nerve. Vitamin E acts as a potent antioxidant that protects nerve cells from oxidative stress, which is often exacerbated by poor dietary habits, aging, and environmental toxins. This combination makes almonds a unique functional food for both preventing and alleviating nerve pain by targeting the underlying biochemical mechanisms rather than merely masking discomfort. Almonds also contain B vitamins, which are critical for nerve repair and proper conduction of electrical signals throughout the nervous system. Vitamin B6, in particular, supports the production of neurotransmitters and myelin, the protective coating around nerves. When nerve signaling is impaired, even minor movements can trigger sharp pain along the sciatic nerve. By consistently consuming almonds, you supply the body with the micronutrients it needs to maintain healthy nerve function, which over time can reduce the intensity and frequency of pain episodes. Consistency is a major factor. Eating almonds once in a while won't produce noticeable results, but making them a daily habit ensures a constant supply of nutrients that support nerve and muscle health. The bioavailability of these nutrients is enhanced when almonds are consumed on an empty stomach, allowing for better absorption of magnesium and vitamin E. Additionally, pairing almonds with hydration and light movement, such as stretching or short walks, helps integrate their benefits into an overall strategy for improving sciatic function. Over time, this daily ritual can translate into improved mobility, reduced muscle tension, and less irritation on the nerve itself. Almonds are also convenient and versatile, making it easy to maintain this habit even in busy lifestyles. A simple handful in the morning is enough to provide a significant nutrient boost without adding excess calories or unhealthy fats. This approach aligns with modern understanding of preventative nutrition, where the focus is on feeding the body the essential components it needs to function optimally. By combining these nutritional benefits with awareness of posture, core stability, and movement patterns, almonds become a small yet powerful tool in supporting the spine, reducing inflammation, and maintaining nerve health over the long term. Magnesium is one of the most critical minerals for proper nerve function, and its role in sciatica relief cannot be overstated. Nerves rely on precise electrical signals to communicate between the spinal cord and the muscles, and when these signals are disrupted, it can lead to pain, tingling, or weakness along the sciatic nerve. Magnesium is essential for maintaining this electrical balance because it regulates calcium and potassium in nerve cells. When magnesium levels are low, nerves become hyperexcitable, which can trigger spasms, inflammation, and increased sensitivity to pressure. This is one of the reasons why many people with sciatica experience sharp, unpredictable pain that can flare up with simple movements such as standing, bending, or walking. By providing a consistent source of magnesium, such as from almonds, the body is better equipped to stabilize nerve activity, reducing irritation and preventing spasms that exacerbate sciatic discomfort. The benefits of magnesium extend beyond nerve signaling. Tight, overworked muscles in the lower back, hips, and legs often contribute to nerve compression, and magnesium naturally relaxes these muscles. When muscles are tense, they pull on the spine and surrounding connective tissues, which can narrow the space through which the sciatic nerve travels. Over time, this sustained pressure can lead to chronic pain and limited mobility. Magnesium helps muscles contract and relax efficiently, which not only eases existing tension, but also prevents future strain. This dual effect makes it a vital nutrient for anyone dealing with sciatic issues, especially when combined with daily stretching, posture awareness, and strengthening exercises that support the spine. Nerve health also depends on the protective covering of nerves, known as myelin, which ensures fast and accurate signal transmission. Magnesium plays an indirect role in maintaining myelin integrity by supporting enzymatic processes that reduce oxidative stress. Oxidative stress caused by free radicals damages nerve cells and can exacerbate inflammation around the sciatic nerve. Antioxidants in almonds, alongside magnesium, help neutralize these harmful compounds, creating an internal environment where nerves are shielded from injury and able to function optimally. This combination of muscle relaxation, nerve protection, and inflammation reduction makes magnesium one of the most powerful natural allies against sciatica pain. The timing and consistency of magnesium intake are also important for maximum effectiveness. Taking it in the morning, preferably on an empty stomach, allows for better absorption and ensures that nerve-supporting benefits are available throughout the day. This is particularly valuable for individuals who experience flare-ups during daily activities or after prolonged sitting. A steady supply of magnesium helps maintain nerve balance, reduces irritability of the sciatic nerve, and prevents sudden spasms that can interfere with mobility and quality of life. Magnesium's influence is enhanced when paired with other nutrients found in almonds, including vitamin E, healthy fats, and B vitamins. This combination supports nerve repair, reduces inflammation, and improves circulation to the lower back and legs. The cumulative effect is a more resilient nervous system capable of withstanding daily stressors that would otherwise trigger sciatica pain. By integrating magnesium-rich foods into your routine, you address one of the core physiological factors contributing to sciatic discomfort, creating a natural, sustainable approach to long-term relief and improved nerve function. Integrating almonds into a daily routine is one of the simplest yet most effective ways to support nerve and muscle health, especially for those dealing with sciatica pain. The key is consistency. Nutrients like magnesium, vitamin E, and B vitamins work gradually over time, and the body benefits most when they are supplied regularly rather than sporadically. Just a handful of almonds in the morning can provide a steady dose of these essential nutrients, ensuring that the muscles around the lower back, hips, and legs are better able to relax and support the spine, which reduces compression on the sciatic nerve. This small daily habit becomes a foundational part of a larger strategy to reduce inflammation and protect nerve function. Timing is critical for nutrient absorption. Consuming almonds in the morning, preferably on an empty stomach, allows for better uptake of magnesium and other fat-soluble vitamins. When these nutrients are absorbed efficiently, they enter the bloodstream and reach the muscles and nerves that require them most. Over time, this consistent supply helps stabilize nerve signaling, reduces muscle tightness, and improves overall mobility. People often underestimate how important timing is, yet even small adjustments like this can significantly enhance the effectiveness of a simple dietary change. Combining almond consumption with light movement further amplifies its benefits. Muscles that are weak or tense contribute directly to nerve compression, and stretching or walking after nutrient intake allows magnesium and other compounds to work more effectively within the body. Even short sessions of stretching for the hamstrings, glutes, and lower back help create space around the sciatic nerve, enhancing nutrient delivery and muscle relaxation. This integrated approach, where proper nutrition meets movement, accelerates recovery and minimizes the risk of recurring pain. Almonds also provide sustained energy, which supports physical activity and improves metabolic function. People with sciatica often reduce their activity due to pain, which can lead to further muscle weakness and increased nerve sensitivity. By providing a nutrient-rich, energy-sustaining snack in the morning, almonds encourage movement, better posture, and consistent physical engagement, all of which protect the sciatic nerve from further irritation. The combination of anti-inflammatory properties, nerve-supporting nutrients, and energy support makes almonds a uniquely effective daily intervention for anyone managing sciatica. The versatility of almonds makes adherence easier, which is critical for long-term results. They can be eaten raw, soaked, or lightly roasted, and can easily be integrated into smoothies, breakfast bowls, or even paired with a small amount of fruit. This flexibility ensures that people can maintain the habit consistently without feeling restricted or deprived, which is often the downfall of many dietary strategies aimed at reducing inflammation or supporting nerve health. Over weeks, this consistency compounds, resulting in reduced tension, improved nerve signaling, and a stronger foundation for core stability exercises. The broader benefit is that almonds support systemic health as well. Beyond nerve and muscle function, they improve cardiovascular health, stabilize blood sugar, and promote antioxidant defenses, all of which contribute indirectly to reducing chronic inflammation that can aggravate sciatic pain. By making this small, simple dietary habit a part of daily life, you create a cumulative effect that supports both immediate and long-term nerve and muscle health, allowing the body to function more efficiently and naturally relieve pressure on the sciatic nerve over time. Sciatica pain often dominates daily life, limiting mobility, interrupting sleep, and creating ongoing discomfort, but addressing it requires more than temporary fixes. Long-term improvement comes from consistent habits that support nerve health, reduce inflammation, and strengthen the muscles that stabilize the spine. By making targeted lifestyle adjustments, including the simple act of consuming nutrient-dense foods like almonds every morning, the body begins to shift toward a state that naturally protects the sciatic nerve and decreases pressure along its pathway. The cumulative effect of these small actions can transform chronic pain into manageable and eventually minimal discomfort. One of the most important aspects of managing sciatica is understanding that the nerve itself is sensitive to both internal and external factors. Internal factors include inflammation, nutrient deficiencies, and muscle tightness, while external factors involve posture, movement patterns, and repetitive stress. When these elements are not addressed, the sciatic nerve remains vulnerable and pain can recur frequently. By incorporating almonds into a daily routine, the body receives a steady source of magnesium, vitamin E, and antioxidants, which work together to reduce internal stressors that directly affect nerve health. This creates a foundation for the body to support itself, making muscles more flexible, nerves less irritable, and overall movement smoother. Consistency is crucial in achieving noticeable results. Daily nutrient intake is not just about a single dose of magnesium or vitamin E. It is about establishing a predictable supply of essential compounds that allow the body to repair and protect the nervous system continuously. When paired with other supportive practices such as stretching, walking, and strengthening the core muscles, this approach addresses multiple factors that contribute to sciatica pain simultaneously. The synergy between proper nutrition, movement, and muscle support ensures that each component amplifies the effectiveness of the others, creating an environment where the sciatic nerve is less likely to become compressed or irritated. The impact of these strategies extends beyond immediate pain relief. Over time, improved nerve function and muscle support help prevent flare-ups and reduce the intensity of pain when it does occur. People who integrate these habits consistently often notice increased mobility, better posture, and the ability to perform daily activities without fear of triggering nerve pain. This proactive approach shifts the focus from merely reacting to pain to actively strengthening and protecting the body, which has a compounding effect on overall quality of life. In addition, supporting nerve health through diet and lifestyle changes improves systemic functions that indirectly influence sciatica. Nutrient-rich foods enhance circulation, regulate blood sugar, and reduce systemic inflammation, all of which contribute to a less reactive nervous system. The benefits are not isolated to the sciatic nerve. The entire body becomes more resilient to stress, injury, and inflammation. By committing to these small, consistent actions, individuals empower themselves to take control of their pain, gradually restoring function and independence. Over weeks and months, these practices reinforce one another, creating lasting relief and a stronger, healthier spine. This integrated approach emphasizes that sciatica is not merely a symptom to mask, but a condition to address holistically. By combining targeted nutrition, particularly almonds, with mindful movement, posture correction, and muscle strengthening, the body can recalibrate itself, reduce nerve irritation, and enhance overall function. This method shifts the perspective from reactive pain management to proactive nerve and spinal health, offering a natural, sustainable pathway to living with less discomfort and greater freedom of movement, while simultaneously improving overall vitality and resilience. Beyond nutrition and muscle support, the connection between lifestyle habits and sciatica pain is profound, yet often overlooked. Small adjustments in daily routines can dramatically influence the pressure on the sciatic nerve and the overall health of the spine. Many people unknowingly contribute to nerve irritation through habitual sitting, improper ergonomics, or repetitive movements that strain the lower back and hips. Sitting for prolonged periods compresses the discs in the lumbar spine, shortens hip flexors, and increases tension on the piriformis muscle, all of which can aggravate the sciatic nerve. Introducing even subtle changes, such as standing intermittently, using lumbar support, or adjusting desk height, allows the muscles and spine to operate in a more natural alignment. These modifications work in synergy with proper nutrition and targeted exercise to create an environment that reduces nerve compression. The role of movement is equally important. Dynamic stretching and gentle activation exercises improve circulation, deliver essential nutrients to tissues, and maintain flexibility in the lower back and legs. Muscles surrounding the spine act as a support system, and when they are weak or tight, the sciatic nerve bears the brunt of mechanical stress. Consistent low-impact activity, such as walking, swimming, or using resistance bands for the glutes and core, helps redistribute pressure away from the nerve and enhances the structural integrity of the spine. These exercises also stimulate blood flow, which accelerates healing and reduces inflammation around compressed nerve pathways. People often underestimate the compounding effect of small, consistent movements, but over time, they can lead to significant reductions in pain and improvements in mobility. Sleep posture is another factor that can influence sciatica. Sleeping on a mattress that doesn't properly support the spine or using inadequate pillows can exacerbate nerve compression during the night. Adjusting sleep positions to maintain a neutral spine, placing a pillow between the knees while lying on the side, or slightly elevating the legs can relieve pressure on the sciatic nerve. Nighttime recovery is critical because the body repairs tissues and reduces inflammation while at rest. By optimizing sleep posture alongside nutritional and movement strategies, the body is better equipped to heal itself and manage pain more effectively. Hydration also plays a subtle but significant role. Dehydration reduces the flexibility of discs and connective tissues in the spine, increasing vulnerability to nerve compression. Maintaining adequate hydration ensures that spinal discs remain plump and resilient, providing natural cushioning for nerves. Paired with a diet rich in anti-inflammatory nutrients, this supports both structural and functional integrity, giving the sciatic nerve more space and less irritation. Finally, stress management influences sciatica indirectly but powerfully. Chronic stress triggers hormonal changes that increase inflammation, muscle tension, and nerve sensitivity. Techniques such as deep breathing, meditation, or brief mindfulness breaks during the day reduce cortisol levels, relax muscles, and improve overall circulation. This approach complements dietary, movement, and ergonomic strategies.